Thank you so much, Steph. The big announcement today when it comes to the province's back-to-school plan, it is coming down at 1:30 this afternoon. But what that school year looks like come September, still not clear. The Hospital for Sick Children, though, putting forward a series of recommendations for a safe return. Their president and CEO, Dr. Ronald Cohn, joins me now. Good morning to you, Doctor.
Good morning. Thank you for having me.
Thank you for joining us yet again. We talked in early June when you first put out a report, and I remember you saying it was very much a living, breathing document. So yes, we have seen some revisions. I want to just put up and remind some of our viewers of some of the points that are in the recommendations here, and then we'll go through some of them. So some of the bigger ones being reopening a school is a must on a full time. We're talking about mental health being a big part as well when it comes to wearing masks for youth and the older students, but not elementary school students. The physical distancing still at play. And there are a number of things that are being considered when it comes to the back to school. So let's first begin with the masks because, Dr. Cohn, there was a little bit of a response here from the Elementary Teachers of Federation of Ontario saying they thought masks where it is mandatory for bylaw, why not have that across the board? Why break that up with age groups?
Happy to talk to you about the controversial aspects of masks, but I want to take a minute, take a step back, and get one key message across. When we look at the number and series of recommendations that we made in this document, it is absolutely critical that we all recognize that it has to be a bundled approach, not one single aspect of safety is going to ensure a whole safe return to school. So I think that's very important. So you can mask every single person in a school building if you don't look at the other safety measures like hand washing, like screening, like distancing. It will be a failure. So now speaking about the masks, we have now worked together with all the academic children's hospitals in Ontario, and I can tell you there has been a significant disagreement among our experts. But by and large, most of these experts felt very strongly that the practicality of using masks for elementary children and even the potential risk by not taking them on and off in the correct way, maybe disposing them in an incorrect way, outweighed the benefit. And that's why we landed on everybody in middle school and high school, particularly when physical distancing cannot be maintained, but not for the elementary school.
Dr. Cohn, I know you've been part of several meetings with the province, and again, we are waiting for the official word from the province at 1:30 this afternoon. What do you anticipate will be implemented? How much into consideration will they be taking your recommendations?
I don't know, to tell you the truth, how much they will take into consideration some of our guidelines, but I am confident that since they have not just been working with our group of pediatricians, but with public health and with teachers, that I'm sure that they're going to be cognizant about the series of safety measures that have to be put into place so we mitigate the risk as much as possible for the students, for the teachers, other school staffs, and also for the parents and their families.
Dr. Cohn, you mentioned full-time in these recommendations versus, say, that staggered or online approach. Why is that?
I think we spoke a couple of weeks ago, actually, together about the tremendous impact the school closures already has had on the mental and the physical health of children. And I think accepting the fact that this virus is going to be with us for at least another year, if not even longer, having all of our children at home for a prolonged period of time, to us as pediatricians and mental health care providers, is simply untenable.
Dr. Cohn, I know obviously you and your team have been sifting through numbers from all over the world and looking at the Canadian numbers aged 0 to 19, making up, I believe it's 7.5% of infections when it comes to COVID-19, so a very low number. We talked about the term super spreaders earlier, about the little ones and what they're seeing when it comes to symptoms or being asymptomatic and whether or not they are able to transmit to the other adults, because there is the concern that someone takes it home as a child at school, brings it to a parent, a grandparent. How do you address those concerns for parents and educators about the spreading amongst students?
So over the last few weeks, as we have updated our document, more evidence has come to light that suggests that the older children, specifically the teenagers, seem to transmit very similar to adults. Hence also our stronger recommendations of safety, including mask and physical distancing for this group. For the younger children, and it was just a study published by our colleagues from McMaster, it still seems to be, yes, little children do transmit, but not to the degree like the super spreaders, or not even to the degree we expected them to transmit. Now, I think it's important to recognize these are all still ongoing data that we have to collect. Our children in Canada have by and large been significantly isolated. And although we don't have any evidence for super spreader events from smaller children in any of the countries who have already opened up society and or schools, we are very, very closely monitoring it. And that's why it's a living document. Whenever we will have new evidence coming to light, we will update.
Indeed. And of course, some things could change between now and school opening. That's good for 5 weeks' time. Dr. Cohen, we appreciate your time and insight in the work that you're doing. Thank you so much.
Thank you for having me. Have a good day.
You too. And again, the provincial update happening at 1:30 this afternoon. City News will be following that.